America, land of the free, home of the brave, and increasingly breeding ground for preventable diseases. How did we get here? Well, in 2025 we got a new president, and with him, a new Secretary of Health and Human Services, Robert F. Kennedy Jr. Now you might know Kennedy as a guy who really doesn't like vaccines. This is a bit like putting a pyromaniac in charge of the fire department. Not ideal. Kennedy's appointment sent shockwaves through the public health community. See, this isn't just about different opinions. This is about ignoring decades of scientific evidence. It's about putting ideology above the well-being of our kids. And the consequences? Let's just say they could be a real kick in the, well, everywhere. Kennedy's stance on vaccines has emboldened the anti-vaccine movement, a group that was already gaining traction thanks to misinformation and fear-mongering. Now, with a powerful ally in the government, their message is spreading faster than ever. And that's a big problem because, well, we'll get to that. The rise in preventable diseases is alarming. Hospitals are seeing more cases of illnesses that were once nearly eradicated. Parents are worried, doctors are frustrated, and the healthcare system is under immense pressure. Over the past few years, we've seen a decline in vaccination rates. This isn't just a coincidence, it's the result of a well-orchestrated campaign of misinformation. The new administration's stance on vaccines has only added fuel to the fire. Public trust in vaccines is eroding, and the consequences are dire. Robert F. Kennedy Jr. has been a vocal critic of vaccines for years. His appointment to a key public health position is seen by many as a step backward. His presence in the government has given the anti-vaccine movement a significant boost. Social media is flooded with anti-vaccine content, and rallies are becoming more frequent. It's like having a firefighter who starts fires. The very person who should be protecting public health is undermining it. Public health officials are alarmed, healthcare professionals are protesting, the medical community is in shock. This isn't just a debate, it's a battle for the future of public health. The stakes are incredibly high. Decades of research and scientific evidence are being ignored. Vaccines have saved countless lives and their efficacy is well documented. But now, ideology is taking precedence over the well-being of our children. Parents are worried, and rightfully so. The consequences of this shift in public health policy are already being felt. Hospitals are overwhelmed, and preventable diseases are making a comeback. The anti-vaccine movement is gaining momentum, their message is spreading, and more people are choosing not to vaccinate their children. Misinformation is rampant. Social media is a breeding ground for false information, and it's having a real impact on public health. With a powerful ally in the government, the anti-vaccine movement is more influential than ever. Their message is reaching more people, and the consequences are dire. The future of public health is at a crossroads. The decisions we make now will have lasting impacts, and that's a big problem because, well, we'll get to that. Let's talk about herd immunity. It's a concept that's been around for a while, but it's more relevant now than ever before. It's not just some fancy term scientists throw around. Herd immunity is a critical public health strategy. It's the idea that when enough people are vaccinated, it creates a protective shield around those who can't get vaccinated, like infants or people with compromised immune systems. This shield is essential for the well-being of our communities. It's basically community teamwork at its finest. Everyone plays a part in keeping each other safe. But here's the thing, herd immunity relies on participation. It requires a collective effort. When enough people opt out of vaccines, that shield starts to crumble. The protective barrier weakens. And guess what happens then? The consequences can be dire. Diseases that were once on the verge of extinction can stage a comeback. We've seen it happen before. Think of it like this. Vaccines are like the bouncers of the disease club. They stand guard, keeping the harmful diseases out. They keep the bad stuff out. But they can only do their job if they're there in sufficient numbers. But when you fire all the bouncers, well, things get messy. The diseases can slip through the cracks. And guess what? We're already seeing the cracks. The shield is weakening. Vaccination rates are dropping, and not just by a little. This decline is alarming. We're talking about numbers that would make an epidemiologist break out in a cold sweat. The stakes are high and the time to act is now. So, what happens when the bouncers are gone? The party crashes start. Diseases that we thought we had kicked to the curb are suddenly showing up again, like that one friend who always overstays their welcome. We're talking measles, mumps, rubella, whooping cough, all the hits. These aren't just childhood illnesses that you shrug off. They can have serious lifelong consequences. Measles can lead to pneumonia, encephalitis, that's brain swelling, folks, and even death. Whooping cough can be terrifying, especially for babies who can cough so hard they actually stop breathing. And the worst part? These diseases were almost eradicated. We were so close to wiping them off the face of the earth, but thanks to complacency and misinformation, we're now going backwards. It's like spending years painstakingly building a Lego masterpiece, only to have someone kick it over because they don't like the color of one brick. Let's talk about measles because it's the poster child for preventable diseases. This highly contagious virus is so good at spreading that it only takes one infected person to potentially infect a room full of unvaccinated people. We're talking about a 90% chance of infection if you're not immune. That's like playing Russian roulette with 5 bullets in the chamber. Measles outbreaks are already happening across the country. Remember those measles parties some parents were throwing a few years back, thinking it was a good way to build immunity? Yeah, those didn't age well. Now we're seeing the consequences and they're not pretty. Hospitals are being overwhelmed with sick kids, some of whom are suffering from complications we haven't seen in decades. Doctors are having to relearn how to treat diseases they thought were consigned to history books. It's chaos and it's entirely preventable. Predicting the unpredictable. Here's the thing about predicting outbreaks. It's like trying to predict the weather, except instead of rain, we're talking about highly contagious viruses. It's complicated. We can look at vaccination rates, but those aren't always accurate. We can track travel patterns, but diseases don't always follow the rules. And even if we could predict outbreaks perfectly, that wouldn't solve the problem. It would just give us a heads up before the inevitable. The only real solution is to get vaccination rates back up to where they need to be. But how do you do that when you have people in positions of power actively undermining public trust in science? It's a tough question, and frankly, I don't have the answer. But I do know this. A nation at risk. The United States is a country of contrasts. We have some of the best medical care in the world, yet we also have a growing number of people who are distrustful of that very system. We have access to a wealth of information, yet we also have a rampant misinformation problem, particularly when it comes to vaccines. This combination of factors has created a perfect storm for the resurgence of preventable diseases. And it's not just children who are at risk. Adults who were vaccinated decades ago may find their immunity waning, especially if they haven't stayed up to date on their booster shots. Pregnant women, who are particularly vulnerable to complications from diseases like measles, are now facing a new set of anxieties, and people with compromised immune systems, who rely on herd immunity for protection, are essentially sitting ducks. A healthcare system caught off guard. Our healthcare system, already burdened by rising costs and staffing shortages, is now facing a new threat, a wave of preventable diseases. Hospitals are being stretched thin, with some forced to convert hallways into makeshift wards to accommodate the influx of patients. Doctors and nurses, many of whom have never seen a case of measles in person, are scrambling to brush up on their knowledge of diseases they thought were eradicated. Diagnostic labs are overwhelmed, leading to delays in treatment. The supply chain for essential medications and equipment is strained, as demand outstrips supply. It's a logistical nightmare, and it's only going to get worse if we don't get a handle on this situation. Beyond measles, a wider lens. Measles might be getting all the headlines, but it's just the tip of the iceberg. The resurgence of this highly contagious disease is alarming, but it also serves as a warning sign for other potential health crises. The focus on measles should not overshadow the broader implications of declining vaccination rates. Declining vaccination rates are opening the door for a whole host of other preventable diseases to make a comeback. These diseases, once thought to be under control, are now re-emerging, threatening public health on a global scale. The empty vaccination clinics and unused vaccines are a stark reminder of the complacency that can lead to devastating consequences. Whooping cough, once rare, is making a roaring return, with outbreaks reported in multiple states. This highly contagious respiratory disease can be particularly dangerous for infants and young children, leading to severe complications and even death. The resurgence of whooping cough highlights the critical need for maintaining high vaccination coverage. Mumps, a viral infection that can cause painful swelling of the salivary glands, is also on the rise. This disease, which can lead to complications such as meningitis and hearing loss, is another example of how quickly we can lose ground in the fight against preventable illnesses. The increase in mumps cases is a clear indicator that we cannot afford to let our guard down. And rubella, a seemingly mild illness that can cause serious birth defects if contracted during pregnancy, is posing a new threat to expectant mothers. The potential for congenital rubella syndrome, which can result in severe developmental issues for newborns, underscores the importance of vaccination for protecting the most vulnerable populations. We're also seeing a rise in cases of bacterial meningitis, a life-threatening infection that can cause brain damage and hearing loss. This disease, which can spread rapidly in close quarters such as schools and dormitories, requires prompt medical attention and preventive measures. The increase in meningitis cases is a sobering reminder of the importance of vaccination in preventing outbreaks. And let's not forget about polio, a debilitating disease that was once a global scourge. The images of polio patients in iron lungs and children with leg braces serve as a powerful reminder of the devastating impact this disease can have. Polio was on the verge of eradication, thanks to widespread vaccination efforts. Thanks to vaccines, polio was on the verge of eradication. The success of vaccination campaigns brought hope to millions and nearly eliminated the disease from the face of the earth. The celebration of vaccination milestones was a testament to the power of collective action in combating infectious diseases. Now, thanks to declining vaccination rates, it's making an unwelcome comeback in some parts of the world. The resurgence of polio in areas where it was once under control is a stark warning that we must remain vigilant. The concern among healthcare workers about vaccination rates is a call to action for renewed efforts to protect public health and prevent the spread of preventable diseases. The long road back. If we want to reverse this dangerous trend, we need to act now. We need to launch a massive public education campaign to combat misinformation and restore trust in vaccines. We need to make it easier for people to access vaccines by expanding clinic hours and offering incentives for vaccination. We need to hold elected officials accountable for spreading misinformation and undermining public health. And we need to invest in research to develop new and more effective vaccines, as well as to better understand the long-term consequences of declining vaccination rates. This won't be easy. It will require a sustained effort from all of us, individuals, communities, healthcare providers, and policymakers alike. But the stakes are too high to ignore. We're talking about the health and well-being of our children, our communities, and our nation. A crossroads for public health. We stand at a crossroads. One path leads to a future where preventable diseases are a distant memory, where children grow up healthy and strong, and where our healthcare system is equipped to handle the challenges of the 21st century. The other path leads to a future where outbreaks are commonplace, where hospitals are overwhelmed, and where preventable diseases once again cast a long shadow over our lives. The choice is clear. We must choose the path of science, of reason, and of public health. We must choose vaccines. The future of our nation depends on it. Take action today. Get vaccinated. And encourage others to do the same. Together, we can secure a healthier future for all.